I think when you go carnivore, you have to think about your oral health in a different way, because dental school only teaches you the subject in the perspective of a standard Western diet. I know that because I did dentistry at Leeds University, where I got the doctor for Dr. Abs. Dentists are taught many things like biochemistry, anatomy, cardiology, drugs, certain types of surgery, even dermatology, because of the skin issues on the head and neck that a dentist is more likely to pick up first rather than a GP, etc., etc., and also nutrition. I know to most those topics might sound like overkill for dental school, but it's because what's done in dentistry can affect you in things like the heart, diabetes, immunity, and so on and so forth. But at least from my experience, when it comes to nutrition, it's taught at university to give certain people and treat certain people in certain ways that follow national guidelines of the country that they're in, regardless of what we're starting to see in nutrition research now. And typically dentists are scared to say anything outside of what they're told to repeat in case they can get in trouble with their governing body. However, I feel it might be worth considering scientific debate over all of that preset advice, which we're told to give, when we see that everything we know in nutrition is now being questioned, with studies like, say, the Harvard one in 2021 on screen now, where patients who were on a self-reported carnivore diet were found to have up to a 98% improvement in various medical conditions such as psychiatric, dermatological, respiratory, autoimmune as well, which is incredible, cardiovascular, even neurological. I was taught to tell patients to cut down on red meat, as an example. But in studies like this, where 85% of subjects had red meat at least daily, we see 98% improvement in medical conditions. And when I used to do dentistry day in, day out over the years, I noticed certain patients who had poor oral health, no matter what they did, and then over time, I noticed that without changing their oral habits like brushing or toothpaste, things just started to get better. Things like tooth decay, technically referred to as caries, and full gum disease, technically referred to as periodontitis, which we often shorten to perio. I couldn't work out how they improved those things, but after questioning, I found out that they'd either gone keto or carnivore. That was the moment my life changed, and I started looking into the work of the most significant dentist who ever lived, in my opinion, Dr. Weston Price. I won't go on about him, but feel free to Google him if you like. And that's when I went headfirst into the deep end of nutrition, which led to studying obesity, then metabolism, then mitochondria, then longevity, which is what I spend most of my time studying and implementing now, alongside the cosmetic side of things. So here are a few things I think might be good to know for your oral health if you're going carnivore, or if you're already one, like myself, for instance. Firstly, there's no guidelines on this. So your dentist can't give you any official government-backed answers, I think. So the only thing you can do is research and try to speak to as many people as you can. Next, refined carbohydrates and sugars are a significant risk factor for both caries and perio. This is because the fermentation of dietary sugars leads to acid production, which can then take out the enamel minerals and promote caries decay. This process is highly driven by bacterial species like Streptococcus mutans, which thrives on a high-carb diet. So when you cut those dietary carbs out, personally, I don't think it's surprising to see people like, say, Jordan Peterson, who had perio before his carnivore diet, come out and say that his gum disease has just completely disappeared after switching to carnivore or lion diet, whichever one you want to call it. So I wouldn't be surprised if many people who have these oral health issues on a standard Western diet experience similar improvements when they go carnivore. Next, there's always been a strong correlation between perio, gum disease, and diabetes. In fact, I was taught in dental school that if someone's diabetes is bad, their gum disease is statistically likely to be bad too, and vice versa. I think this correlation does exist, from what I've seen in my own patients, at least, in my own experience and patients, at least. However, as people's diabetes starts to go away from cutting out or cutting down on dietary carbs on carnivore, I suspect the bleeding gums they have in gum disease or gingivitis may cause less damage. This is because the bleeding is going to have less glucose in it now to feed the bacteria that are there. So if your blood glucose levels are under control now, that bleeding, I suspect, won't be as nutritious to keep those bacteria alive, which are being fed by the glucose in that bleeding. Next, bad breath. When you change diets, it's not just your gut microbiome that changes, it's your oral microbiome too. This is one of the things that determines the smell of your breath. So expect the smell to change. If it gets worse, I think it might be more to do with the brushing technique than anything else, personally. When we have more meat, I think there's more fibrous and stringy material that can get stuck in between the teeth, which you may miss with your toothbrush. So my advice on this is to use something like a water flosser, which fires a jet of water between the teeth to dislodge stuff out on the other side. I've put an affiliate link to one on Amazon in the description below if you want to see one that's cheap and still does just as good a job as the more expensive ones. I use it all the time after a meal, and it works fantastically because when I go around after it with floss, traditional floss, there's very little, if anything, left to clear out. I personally advise water flossing after every meal. It takes like 20 seconds to do the whole mouth, and there's no harm to the teeth because it's only water. But when you first start, it may sting the gums if it's too powerful, so aim well and do it regularly if you can. If the gums are bleeding from it, it's not necessarily a sign that it's bad for you. It could just be a sign that there's indeed gum disease to treat. In that kind of situation, I'd advise seeing your dentist to get a possible diagnosis if needed, and then some personalized oral hygiene tips, instructions from them, whatever you want to call it. The next one is personal for me. More teeth equals better health. I'm sure every dentist in the world would agree that there's an observable correlation between those that have all their teeth into old age and those that aren't on a list of medications as long as there are. Now, with what we've said so far about not feeding the oral bacteria dietary carbohydrates and reducing the risk of gum disease and caries, like famous examples like Jordan Peterson, if you look after your oral health better and have all your teeth as you get older, which I personally feel carnivores are going to be statistically more likely to do, I think it's safe to say that you may be the kind of person that, for many reasons, has a higher correlation and causality of living longer and in better overall health. And it's one of the reasons I became so obsessed with studying longevity medicine. And it's nice to be studying it from a starting point like dentistry, because we already get taught things like biochemistry, cardiology and urology, micronutrients, and more. So I have a really nice start in understanding many different topics all at the same time, just like all other dentists and medics out there. And it's the same when you look at people like Peter Attia, for instance. Now, I don't agree with everything he says, for the record, but I love the fact that, like me, he never did a qualification in longevity medicine because nothing like that exists anywhere. Instead, he had the initial healthcare field he focused on, and then because of his passion for medicine, he kept reading and studying just beyond the edge of that field all the time until the edge of his knowledge became much, much wider. And he can talk about longevity and nutrition and many other topics with a nice knowledge base. You look at someone like, say, Dr. Berg, for instance, who's a chiropractor and gets a lot of stick from people for being one. But at the end of the day, I don't really care if he is one or not. I care about the science that he talks about. If he shows that vitamin D is essential for good health, it's not wrong just because a chiropractor said it. Facts don't have veracity based on who states them. They have veracity based on evidence. And when you look at the very strong link between oral health and systemic health, like heart disease, diabetes, learning disabilities, sarcopenia, which is muscle wastage, and more, I think it's pretty safe to say that you should prioritize your oral health just as much as your systemic, because there's so much great evidence for them being highly linked causally and not just correlationally. Next, which toothpaste do you use? Frankly, the brushing technique's more important. You can use what I've seen people talk about, like tooth powder, salt things, fluoride toothpaste, non-fluoride toothpaste, you name it. But think about it this way. If you give someone the best toothpaste in the world, whatever that is, but they don't use the brush very well, there's still going to be plaque, which can cause problems. But if you give someone no toothpaste and tell them to just use water, but they clear every single bit of plaque in the mouth because of good brushing technique, then they're probably going to have no problems. And hopefully with that simple thought experiment, you'll realize that the way you brush is more important than what you brush with in terms of toothpaste. Which leads me on to the next thing very nicely. Which brush and brushing technique do you use? Well, here it is. Electric toothbrush, in my opinion, is always better than manual. don't spend ridiculous amounts of money, because more expensive doesn't mean better health or better teeth. I've put an affiliate link to what I use in the description below. Round head, so it can fit the contour of the gum line. Change the head every couple of months so the bristles are still effective. Google something called the modified Bass technique to know the best actual brushing technique, because there is such a thing. And finally, consider things like water flossers, as I've said, as well as traditional floss if needed, because meat isn't always easy to remove when it's stuck between teeth. Now, this obviously isn't the entirety of dentistry, because it took me 5 years just to get the basics. But hopefully it's given you a succinct set of things you can do today to improve your oral health. And you can always comment down below if there's other things you want a video on.